Yes, greetings to you, and hopefully you're doing well. I want to welcome you to our studios at TV Talking Health, and we are bringing out something that is very, very exciting, and that is First Aid at TV Talking Health. A series of this is going to be happening to help you on the simple procedures that you can carry out at home to make sure that you can live a healthier life. Even medical students, nursing students, you can take this opportunity to learn these wonderful skills that me and you need to help the people out there. And this program is proudly sponsored by Mitiana Institute of Nursing and Midwifery. And for admissions, you just need to contact us at HBMS TV. We will be guiding you on how you can join the nursing school and how you can join different medical institutions that are going to help you learn more and more about health and be a productive person in this world. And when you look at our series, this is our first series. Very soon we will be having more series about this. And we are going to be discussing how first aid can be promoted in different institutions of learning. And you'll bear me witness that each year, thousands of people are injured or killed in accidents, either on job or at home or even in our communities. So we can save many lives if first aid is taught in schools and colleges. So this program is to empower more students, medical students, nursing students who want to learn more about first aid. And this program will actually provide basic knowledge and skills to prepare an individual to deal with accidents and emergencies. And the structure and function of the human body are also going to be explained in this series in a great detail first, so that the first aid measures to be taken for various injuries and emergencies can easily be understood. And in this very program, simple figures, even diagrams and illustrations will be included to explain the program and how it works. But special emphasis is going to be placed on the management of casualties during either biological, chemical, or nuclear disasters. All these things do happen in our environment today. And this program is useful for every man and woman who cares for their life or even for the lives of others. And it will be useful in training all individuals, especially medics, talk about ambulance crews, talk about policemen, talk about scouts, and then the guides. And all this is going to be happening at HBMS TV Talking Health. And in order, I want to bring it to your notice that in order to preserve or promote life, first aid should be integrated in school education at a very early stage. This must be taught to people where they are still young. And the disasters, whether it is man-made or natural, are increasing day by day. You'll bear me witness. And one must understand the value of the initial period. We call it the golden hour, the first time when somebody has just gotten an accident, which can prevent worsening of the casualties condition if one is a trained first aider right from the community level and at an early stage. So you will know that first aid is not something that is just coming up. It has been there. And when we talk about history of first aid, I want to tell you that the first aid concept existed in the ancient period too. It is not something that is new. And our ancient history of Mahabharata, Magal, and then Siddhas are full of instances of caring for the wounded and sick, irrespective of caste, irrespective of color, creed, talk about religion, talk about language, either friend or foe. All these things were not considered when giving first aid. Anyone deserves to be worked on. And father of all nations, that is Mahatma Gandhiji, dedicated himself as a volunteer in the ambulance corps. He carried wounded General Bulla to the base hospital as an act of mercy to a friend or foe. And when you look at the German surgeon, the General Esmach conceived the idea of first aid. And that is how it all started. Then the St. John Ambulance Association was formed in 1877, so many years back. Yeah, that was the beginning of providing first aid at an international level. Later on, we had the Red Cross Society, and that is the worldwide organization working towards humanitarian mission. And then the Indian Cross Society was also established in 1920. So when you look at this history, it simply shows you that first aid has existed. But you who is following us at HBMS TV, your question should be, what is first aid? What does first aid mean? First aid is the immediate care or help given to a sick or injured person before full treatment or medical help is given, the initial treatment. And what should be your aims? You who is following us at HBMS TV and you want to help people out there, what should be your aim as a first aider? Number one, you look at saving life. You must look at promoting life. Then the other one is to prevent worsening of the casualties condition. Then talk about relieving pain, then relieving anxiety, to make the casualty as comfortable as possible, then to ensure that proper and immediate medical care is available and given. Then the other one is to transport the casualty to the nearest health facility or hospital as early as possible. And what is the scope of first aid? The scope of first aid involves the diagnosis, treatment, and then disposal. That is what is entailed in the scope of first aid. And when you look at diagnosis, that is taking proper history, checking signs, maybe bleeding, maybe paleness, maybe the symptoms and all that. Then the other one is treatment, removing the casualty from danger, then make the casualty as comfortable as possible, then continue assistance until further management arrives. Then when we talk about disposal, that is to the nearest shelter by the quickest means and possible, or to send a word even to the relatives. All that is in that. And I want to tell you that this program is proudly sponsored by the #1 food supplement, that is C24/7. For those of you who are following us at HBMS TV, you need to look out more for this product and know what it does. And what should be the priorities of treatment in case of an accident? The first aider should, #1, they observe carefully, think clearly, and also act quickly. It should be within you. And more, I'll also explain to you the step-by-step action to be taken by a first aider. And that involves examination and diagnosis. If there is cardiopulmonary resuscitation, you need to do it. Every second counts if it so requires that. Then you need to look at controlling bleeding, then talk about treating shock and special care of the unconscious cases, then talk about fracture, you immobilize them, then talk about when it comes to burns, you cover with clean washed dressing or even washed clothes and treat shock. Then you look at the eyes, nose and ear injuries, multiple superficial injuries, then more importantly, even transportation. And what should be your qualities? You who is following us at HBMS TV. Your qualities as a first aider. Let me tell you where we are going. Each and everyone needs to be a first aider simply because there are very many disasters that are happening in our environment. And #1, you must be observant, you must be tactful, self-control, then you must be resourceful, you must be knowledgeable and skillful. Those are your qualities. And when you look at the principles of first aid, the principles are very simple. Remove the casualty to a place of safety. That should be your priority #1. Then the other one, loosen clothing around the neck and waist to aid breathing. Then reassure patient if conscious. If they're unconscious, you need to talk to the relatives. Then look for the following. Failure of breathing, artificial respiration must be done. Failure of saturation, external cardiac massage. We will be discussing these things in the future. Then severe bleeding, apply pressure on pressure areas. Then signs of shock, we'll be looking at shock as itself in the series that we will have. You need to manage it. Then relieve pain, avoid handling the casualty unnecessarily, then arrange for safe removal of casualty to hospital or health facility. Then the other one is we have the rules of first aid. Make haste slowly. Don't refuse when you're advised to work on something. Then the other one, don't attempt too much in giving first aid because you may cause more injuries. And now, what are the do's in first aid? These are some of the do's in first aid if you're providing first aid. Attend to the casualty as per priority. Who is badly off, who is not doing well, attend to them. Then the other one, attend to the children and women first. Women are mothers of the future, then children are very delicate. Then the other one is ensure your safety first. Don't act too much, forgetting about your safety, then follow given precautions, especially in cases where there are infections. Then the don'ts in first aid. Don't forget that you are not a doctor. You're just a first aider. Giving first aid, then the medics will do their role while they're in the hospital. Then don't overdo things. Do not handle the casualty unnecessarily. Do not overexpose the casualty. It may result in two dangers. Don't just open wounds that have been closed. Then do not remove fracture without proper splints. Don't forget about tourniquets. Don't declare casualty dead. It's not your role. And now, more importantly in this series, I wanted to look at a first aid kit. It is mandatory to have a first aid kit in every workplace, like schools, like colleges, houses, and vehicles. If you're out there and you do not have these first aid kits, we can help you get them. Then it should be kept at such a place which is easily accessible. Also, everyone should be aware of it. It should be labeled first aid, and it should have a red cross on a white background. And from time to time, its items should be checked and replaced. If an item is used, it should be replaced. And all the required items should be available, ready for use at all times. And I wanted to give you the minimum content of the first aid box. And these include a torch. You must have a thermometer in. Tongue depressors, I've seen people using ice cream spatulas. Then talk about writing pad. You can have a pencil open in, bandages of different types. We will be sharing them. Then gauze, talk about cotton, iPads. Then talk about scissors, plaster, safety pins, tourniquet, ORS packets, glucose packets, methylated spirits, iodine tincture, benzoin tincture. All these things must be into the first aid kit. Remember, this program is proudly sponsored by Mitiana Institute of Nursing and Midwifery. You who is out there and you want your child to do nursing, you can contact us on the numbers you see below there, and we will guide you on how to get admitted. And not forgetting Masaka Home-Based Medical Services International, a body that is making sure that a lot of people can access medical help while they are in their homes. Thank you very much for following through, and may God bless you. HBMS TV, Talking Health.